I'm going to go more in detail this time, and I'm going to talk about my sexual reassignment surgery, what it meant for me, how I recovered. A lot of people talk about SRS as a goal or as a dream or as kind of an idealization of what it is, because while it is something that was so amazing and I'm so grateful that I got to do it, it's a lot more of an undertaking for some people than it is for others. And there are a variety of reasons why. So, if you remember my last video, I talked about where I got my surgery done. I talked about what I had to do prior to it. So I'm not going to go too in depth on that. I'll talk mostly about the recovery. I had my surgery done in San Francisco. I had to be on a wait list for a very long time. I had to have certified gender dysphoria as confirmed by a therapist. I had to have letters from 3 other therapists to back up that I was dysphoric enough to need this medically. And by the way, it is expensive to get therapists to write a letter like that. Like, most of them wanted at least like $100, and I realized that's not realistic for everyone. I was able to get my surgery covered by my insurance, but it was hard fought, and it took us a long time in order to get that. And I'm so thankful for the lady who worked with our insurance company who actually fought for us and on behalf of us, because I realized that it is a privilege to be able to get a surgery like this that not everybody has access to. But for those of you who are going to get surgery and want to know what I wish I had known, I'm going to give you a list of things that I think will help. The first thing I want to talk about is post-op recovery, because those first 2 weeks after the surgery are the only time in my life where I truly do not have much memory of it. And I think part of it is the reason that I was medicated, and part of it is the reason that it was just very physically traumatic and my body was going through a lot. I was a particularly difficult case because my body was resistant to the anesthetic, but I had a very low pain tolerance, and they had to really go ham on me with painkillers, and that was brutal for an entire other type of reason. Remember how much pain I was in. That's the only thing I remember. And had I not had my mom and my partner with me at the time, I don't know if I would have been able to recover it the same way. There are some other great YouTubers that have documented this process. Princess Jules documented hers, and she's been very open about the struggles that it did have. And I think she and I both, I'm not going to speak for her obviously, but I am perfectly happy with the results, living with it now, but I really did not know what I was getting myself into, which is funny if you think about it. But because my body was so resistant to the medication and I was on such a high dose of painkillers, that was very hard for me in the recovery process, because I had to wean myself off. And I'm not going to go into this completely, because there is an entire epidemic of this all throughout the world, which I think goes hand in hand with the mental health epidemic, but that's a whole other topic. If you struggle with painkillers, maybe your body craves them, maybe you process them weird. I know that when I was on painkillers, I would have the most horrible nightmares. They were the most horrible nightmares, and I could not get out. It was like lucid dreaming where you're stuck. Anyway, if you are a person that has trouble with painkillers, you ought to reconsider this surgery, because I do not know if I would have been able to handle it if I didn't have access to that. And not just that, the electrolysis is a big part as well. I had to get electrolysis for a year pre-op on the areas that were going to be used for the vaginal lining, because if you don't do that, it can really mess with the results. And electrolysis is really painful, but in your nether regions, electrolysis is incredibly painful. So be very wary of the pain element, is I guess what I would say. And I would recommend CBD. Just saying. The next thing I want to talk about is how post-op I had to relearn how to use the bathroom. And I guess it's pretty self-explanatory, and most people would expect that, but post-op you have to live with a catheter, which is painful and awful in multiple ways. It was only about a month, but I remember having to relearn how to pee and sitting on the toilet, and I was in pain and I was very scared, and I was able to do it, and that feeling of euphoria when I'm not going to get it. It was a huge relief. There's nothing more intimate than this surgery, and it is very, like, Another video I want to do at some point is the mental impact it has when you transition, both because of the physical changes, you're going for second puberty, and because of the social ostracization that happens when you transition. I think most people who are trans can understand that. And so all of that can have a profound impact on your mental health already. And then you're changing your body with medication, and in some cases getting really invasive surgeries, and it can really, really affect your mental health. So one thing I would say to trans people in this position is make sure you don't try to overexert yourself. Transition fatigue is a thing, and it can really make people neglect their mental health because they're focused so much on their physical health. And I think those two need to go hand in hand. You know, transitioning and SRS and all of these things made such a profound impact on my mental health in a good way, but also at the time, it wasn't an immediate fix or anything. Like, it really was a chrysalis moment. The biggest thing I want to talk about this video is dilation. When you are recovering from SRS, is that it is expected that you will dilate regularly, multiple times a day. And for those of you that don't know what dilation is, you essentially use a dildo, and you need to make sure that the area is getting stretched and exercised, because when an area is cut and it is healing, if you do not massage it and if you do not work it, it will essentially treat itself as if it were a wound. And sometimes it's just going to do that one way or the other. 10% of patients develop a condition that I developed where the body treats the area as a wound and develops scar tissue. And according to my doctor, this is only happening to 10% of his patients. But it is important to recognize that this can happen to anyone depending on how you care post-surgery. After my surgery, I was expected to dilate like 4 times a day, and it was a very invasive process, and I do believe that I wasn't doing it correctly, because the point of the dilation is massaging and, exercising the area, but you also have to be very careful to not overexert the area and not make it swell and not make it inflamed, essentially. And I believe that when I was doing my post-op care, I was being too frequent and too invasive with my dilation. In an effort to do everything right, I became so swollen down there and so inflamed that it was very hard for my body to heal. And keep in mind, they tell you that you need to dilate like 3 times a day, then 2 times a day for like weeks and weeks until you're eventually dilating 2 times a week. But that's not only until like 6 months post-op or something. And during the course of my recovery, I was noticing that I was inflamed and struggling to dilate, and my doctor told me that I needed to dilate more, otherwise that would continue to get worse. But I'm going to be honest, I want you to not take my advice as that of a medical professional, but just as a personal anecdote. I believe that dilating more is what caused me to continue to be inflamed and in pain, and I developed kind of a chronic pain, and I was going to physical therapy, and the area was all scar tissue, so it was closing up, and it wasn't entirely willing to be dilated anymore. Everybody's body is different, and for some people, knowing the risks might change whether or not they want this surgery. It's expensive, it takes a lot out of you, it takes a lot to recover from, and if you're not happy with the results, which I am, but not everyone necessarily would theoretically be, it's important to weigh the pros and cons. With the physical therapy, I was able to slowly regain some of that elasticity and malleability of my vaginal wall, and I did contact my doctor again, and they realized at that point that more dilation wasn't going to help, and they took me in for a visit, and they realized that I had a revision that some trans women do end up having. Post-surgery, they told me to dilate a lot more, and I'm going to be honest, I didn't. And I'm so glad that I didn't, because dilating as often as they wanted me to was making it so that it was very hard to derive physical pleasure from penetration, and that was always something I wanted with my vagina. And let me tell you now, looking back 2 years later, the sexual stimulation and the sexual validation I'm able to get is unlike anything I've ever had, even pre-SRS. Genital dysphoria can really affect your ability to have a healthy sex life, but I am so glad that I let my vagina heal before I overexerted it with dilation. And there came a point where I did not dilate except for sexual encounters with my boyfriend. I was able to regain that love and that good feeling from penetration that I did not have before, because it was associated with physical therapy and dilation. And, my best advice to a recovering SRS patient is to still dilate, obviously, but don't do it as invasively as you want to. When you dilate, they give you these hard plastic dildos. I learned from my physical therapist the best thing you should do is these soft, malleable rubber ones. The hard plastic can bruise your vagina, whereas the soft plastic is a lot more malleable, and I had a lot better results with it. I would focus a lot more on width than on depth, because when you force your depth as you're dilating, you are essentially tensing the pelvic floor. And what happened to me is my pelvic floor muscle became cramped and strained. And that happens when you're trying too hard to push your vaginal depth. So work on massaging and not penetrating. And the other biggest thing I would say for somebody who is currently in the process of dilating is try to do it in a way that arouses you. They say to do it so often that there's just no way to be aroused by that. And it's obviously not realistic to get horned up three times a day. But I will say that your best dilation will happen when you are aroused, because that is when the area wants to be massaged. That's when the area is open to it. So just make sure that you don't associate it with that chore or that pain or that discomfort. My best friend also had SRS around a similar time as me. She recovered very quickly, and her vaginal elasticity and recovery was honestly, it was very hard for me because I was so envious of what she had. Everybody's different. Don't expect your experience to be like mine. Everybody responds differently to pain. They respond differently to scarring or healing. My body developed scars on my back when I grew in middle school because I grew so fast that I got stretch marks. But not everybody's skin is prone to that. So just make sure that you take what I'm saying as a personal anecdote, not as medical advice, not as what you should do. Fast forward to where I'm at now, and I'm going to be honest when I say most of my life I had never been sexually fulfilled. As a gay man, I was not sexually fulfilled. I had a really bad relationship with my genitals my whole life, and it did affect my ability to even want to be fulfilled, if you know what I mean. Now that I am years later from my operation, my revision, my physical therapy, and my body is healed, and I'm getting regularly stretched, I'm getting regularly massaged, I can tell you that I am so happy with the results. And I want this to be a hopeful story because I was one of the 10% that developed these complications, which does happen. But I want you to know that there is a light at the end of the tunnel. I do still have a small member, but I still have and am able to have penetrative sex. I'm able to have fulfilling sex, fulfilling orgasms. That's another thing. You have to relearn how to orgasm with your new genital. And for some people, it takes a really long time. Even with all my complications, I was able to a month post-op, and that's pretty crazy. But just remember that everybody is different. Some people I know, it took them years before they were able to have their first orgasm, but let me tell you, the female orgasm is much different from the male orgasm, and it is amazing. Another thing to keep in mind is that the recovery process, the preparation, everything with SRS is going to be a lot different than those who get orchiectomies. If you are a trans woman and you do not know what an orchiectomy is, I recommend you look it up. Because a lot of the reasons for people wanting SRS is so that they can remove their testicles, so that they no longer have to fight the testosterone in their body that's being produced. But you can do that without removing your member, and a lot of people don't know that. So I know people who've gotten orchiectomies, they're perfectly happy with the results, and the recovery process it's not as invasive, it's not as difficult, and most importantly, if you have an attachment to your genitals despite your dysphoria, I recommend you look into that. So just remember that you do not need this surgery to be a woman, because people are going to tell you what they think you are regardless of what you are. So no amount of you having a vagina is going to stop TERFs or farts from telling you all the ways they hate you. You know, people are always going to say that. And as a trans person, unfortunately, we're always going to have to prove our own validity. So don't think that you need this surgery, because you don't. But if you're like me and you had the means to get it and you really did want it, this is hopefully going to be a helpful video for you. I hope the best for your recovery. I hope you are not one of the 10%, but even if you are, it'll be okay. And just promise that you won't go in with unrealistic expectations. And please, please do not let my video discourage you. So, have a great day, and I'll see you next time.